So this week we're going to talk about kind of the best of both worlds. We're going to talk about mixed methods, which takes both quantitative and qualitative methodologies and uses them to really, at their best, to define or to kind of solve a solution for a research question. So I'm going to walk through a bunch of different mixed methods designs, and I'll give you ways that they would be applicable. And as I walk through, I want you to think about how could I use this design within my own project or my own research question, right? Applying is always the best. So, right, you see the quantitative and qualitative, taps or water faucets, right? That when you're a mixed methods thinker, what you do is you're looking for the best solution for a research question. So you're bringing in both the idea of the quantitative world and you're bringing in the best of the qualitative world. And you're okay working in a middle ground that really is a combination of both. So what is mixed methods? It's using both. So you could use surveys and focus groups. You could use surveys and open-ended interviews. You could use a combination of any of those. And each thing will tell you something else. So the quantitative approach will tell you the strength of a relationship or numerically quantify a relationship, but the text will explain how, right? So I'll give you this example of the survey we did that for some healthcare practitioners working with older people, the stress level went up during COVID, and for some, the stress level went down. So we can quantify the change in the amount of stress people had throughout the pandemic, but we don't know why the stress went up or why the stress went down. And I'll give you one example of how stress went down. And a couple of the individuals we surveyed, when we talked to them and interviewed them, they said that they felt the teamwork improved, and they felt that over the pandemic, they bonded, and they felt a sense of camaraderie and companionship, that they had survived this experience, this novel, unknown experience together. So their stress went down because before the pandemic, they were individual practitioners, but during the pandemic, they became a really close team. So the numbers tell us the amount of stress or change in stress level, but the qualitative tell us why and what happened behind that relationship. When do we use mixed methods, right? The more complex the topic, the more complex you want the solution. And you gain the benefit of using the quantitative to explain the qualitative and the qualitative to explain the quantitative. So you have a really good synergy of both of those methods. Now, I love this terminology. I think it's really kind of fun, but I want you to see the logic in it. So you can do convergent parallel design, right? You all are professionals in healthcare. You know we love jargon. So the qualitative or the quantitative method are not, one is not favored over the other. They're both used in the beginning. So let's say we have, we're looking at rates of satisfaction with people who use hospital services. So we could be doing a survey with one group, and we could be doing open-ended interviews or focus groups with another, right? So just collecting textual data. Both are in capital letters because both have equal interest within the study, and we compare the results and we interpret it. So we might learn different things, just as we did from the example with the stress and the practitioners, that, for some stress we could measure the stress, but then the qualitative portions also helped us understand what was going on with the stress. So this one is called convergent. They converge and they're parallel. They work together in a parallel way, and they converge together. Here's another example. Let's say we want to understand why people choose not to get vaccinated, the COVID vaccination in Maryland. And, we know what some of the barriers are, right? We all know why some barriers in literature, some barriers that are anecdotal in society about non-vaccination. So convergent parallel, we can do a survey, the quantitative piece, and again, these open-ended interviews. And they'll give us different types of barriers, right? We may understand from the survey the number of barriers or the names of them, right? Maybe access to free vaccines, transportation, stigma, mistrust of healthcare system. But maybe in the qualitative data collection, portion, we'll get different data that will really flesh out or further explain like why people are not getting vaccinated, right? But both of these are happening together at the same time. Compare that to exploratory sequential. And I'll tell you why it's called exploratory, because it begins with the qualitative phase, right? It begins with this qualitative phase. You're exploring some phenomenon. You don't know a lot about it. The qualitative piece comes first. That's why it's all in capital letters. It's followed by a quantitative, and you interpret. So maybe you do some focus groups to understand, you know, what are some barriers that people are saying in Maryland for vaccination, right? Their geographic and regional barriers. Then you design a survey, right? You follow up with the quantitative portion and you design a survey based on what you learned from your interviews as barriers, and then you interpret it. So sequential, right? Exploratory, meaning qualitative in capital letters, is the driver. And here's another example, right? All examples just to give you more background. So if one works better, please, you know, feel free to stick with that example. In this case, we're looking at, we want to learn, you know, caregivers for older adults with Alzheimer's. We really want to know kind of what their biggest challenges are, what their biggest stresses are. Now we have an idea of them in our head. We can do an empirical lit review, but why don't we do what makes sense, right? Go to a group of caregivers and interview them and say, what are the barriers that you have and the challenges being a caregiver of an older adult with Alzheimer's disease? Once we identify them first, then we can make a survey, and we can take that survey out to a broader group of people and see if that broader group of people also echo the same experience of this initial group, right? This is the reverse. So if it's exploratory, qualitatives first. Qualitative explores. If it's explanatory, qualitative comes second, right? Exploratory, you explore first with qualitative. Explanatory, qualitative is second. So you begin with the main method that you're interested in the study, which is quantitative. So let's say that you do a study, a survey, like we did with those health practitioners, and we found the weird results about stress decreasing for some practitioners during COVID. Well, we didn't know why. So what we did was, to understand that gap, we actually did interviews with people, right? So you get data, quantitative data that's weird, right? I also had a survey done with a housing project when I was in Colorado, where everybody said that the services and everything was great in the housing project. That was weird. So what we did was we did interviews to follow up, and we found out that the reason people said that is because the people interviewing them were those who controlled their rent reduction benefit. So it was a problem with social desirability. So you learn as you do each of these methods that one adds to the next or explains like findings. Here's an example, right? That like legalization of marijuana, right? A lot of the students are talking about this in class, right? And since the recent changes in our state, but you want to know about attitudes toward legalization of marijuana. And there are a lot of complicated responses, right? People might agree with it, but not want it within their community, or, you know, want it only for medical use. I mean, very complicated patterns. So you might get these outliers and things that don't make sense in your survey. So you begin with a survey, you get some data. You don't know why people are saying the things they're saying, right? That they might want to legalize, but only for medical purposes, or, you know, some pattern. You can actually ask people. So here's what we learned in the survey. Can you explain why? Enriches what you know. And that here's ways to calculate kappa. Kappa, what it does is it just tells you inter-rater reliability. So if you're having two people code or a group of people code quantitative data, you do Cohen's kappa, and it just says like, how are you coding or rating the same thing? So sometimes if you work with a team, you may encounter that. Now, you have to have a lot of skill. If you're doing a mixed method study, you have to know, it's like a mixed martial art, right? Think about this, right? You have to be an expert in qualitative, an expert in quantitative, and an expert in bringing them together. So that's a scarce group of people. And you have to have resources. You may need quantitative software, qualitative software. You may need time to collect qualitative data and then analyze quantitative data. So it will take time, right? It's just time consuming, but it's also enriching because you will learn quite a bit about your study. And I'm going to give you an example of something from my textbook, but it shows you how you can merge all the findings. So in this case, somebody was looking at transitions of care for older adults who moved from their home into assisted living. So in the qualitative portion, they did open-ended interviews, and the themes that came out were, when I moved, I felt a loss of home and independence. I felt a change in my identity. I didn't know my social networks. I maybe lost friends that I was friendly with at home in my home. I don't like the hospital-like environment of skilled care. And I like the safety net. So these are all the themes that you got from the qualitative interviewing, right? And if you look, well, that should be quant. I'm sorry, this should be quant odds ratio. This is quant, not qual. You see that when we did the statistics, we did a survey or logistic regression, we found the things that were important in terms of adjusting to skilled care were individual resilience, size of someone's social network, personality factors, living in care longer, and having participated in activities where you live in your care setting. So we know what the issues were with the transition in terms of feeling and ideas. We understand what was the most vital when we did logistic regression, and we're taking the qualitative and quantitative and we're merging it. And what are we finding? Right? We're finding that transitions in care, mixing both methods, are influenced by many factors. There's the resilience from the quantitative odds ratio, right? Anything more than one is a greater benefit. And that having social networks, participation, giving people time are all benefits to adjusted to assisted living. So what you see is we're taking the best of both worlds, and this should read quant, right? Quantitative odds ratio, qualitative themes together give us a holistic way of looking at what are the factors or barriers that help people successfully adapt to moving into assisted living. So there's a lot of terminology, and I understand that it might be a bit much, but I just want you to think that the benefit of mixed methods is you can take the strength of any individual method alone and combine it. Yes, it may take a little bit more time to learn the terminology, to do the data analysis, but what you end up getting are data that are robust and really broad, and those data can really help you when you are wanting to solve a more complex question, a research question. So I'm going to stop here. And then next session, I'm going to go over some qualitative coding and set you all up for discussion 5.